Hi, my name is Sue Lamb and I'm an MSN student at the University of Texas in Arlington's Academic Partnership Program. Today I'm going to be presenting an educational process using the theory of progressivism. Progressivism uses the tools of problem solving, critical thinking, and a collaborative team approach to developing an educational process. During a clinical quality meeting that we held recently, it was discovered that the use of the rapid response team was not being utilized appropriately. We did a 3-month process to look back to see how often the rapid response team had been utilized. And it had not been utilized at all, and there had been 2 code blues and transferred ICU that had taken more than 2 hours. We decided to develop a subcommittee to include ICU, med-surg, women's services, as those are the most common areas that rapid response teams are called. Thank you all for coming. Today we called this meeting in order that we could discuss the problem of the rapid response teams. In the past few months, there have been several transfers to ICU and several codes that have been called, and a rapid response team was never instituted. Rapid response teams, as you know, need to be utilized in the case of a deterioration in patient's condition. And in order to improve patients' outcomes, we need to make sure that they are being utilized correctly.
Well, I've heard about the rapid response team in nursing orientation, but after that it was never discussed again. I'm not sure how many of the nurses actually and other staff know how the process works and how to utilize it.
That's interesting. Sounds like we need to do some education and reintroduce the process to the staff. We could also develop something that will remind the staff that's available and show them how to activate it when it's needed.
At another facility that I worked, we had signs in the patients' rooms that not only directed the staff, but it also helped the patients to understand what the process was in activating a rapid response team.
Well, didn't they have people calling all the time, even when maybe just to go to the bathroom if the nurse didn't respond quickly enough?
Surprisingly, no. We educated the patients at the very beginning of their admission about what rapid response teams were and what they were for, and that they were to, if at all possible, call the nurse first. And we didn't have any problems with false calls.
Right. I think this would be a great addition to the process. We just need to develop a flyer that can be put in each patient's room that's easy to see. We could use Spanish on one side, make it easy to hang so that the patients and staff can see it.
We've got the skills fair coming up in 2 weeks, and I think that would be a great time to start educating staff. Maybe we could create a poster board and a presentation where it explains how to activate a rapid response team.
Great idea.
This is the poster board presentation that was developed by the subcommittee for the rapid response team. The board explains what the normal ranges are for vital signs and what to look for when there's a sudden change in any condition in a patient, such as level of consciousness, neuro changes, and when to call for a rapid response team. The role of the nurse is in assessing, stabilizing, supporting, analyzing, evaluating, and educating for the need of the rapid response team. They are also responsible for making sure that the patient is transferred to the ICU in an appropriate manner. The outcomes or results after use of a rapid response team is to ultimately improve patient outcomes by reducing the number of cardiac arrests and unexpected deaths. Rapid response teams signs will be placed in all patient care areas with instructions for hospital personnel, families, and patients on how to institute a rapid response. They will be in English and Spanish in order for the majority of the patients at this facility to be able to understand. Instructions will be given at admission.
This is the Rapid Response Team Education Board. These are going to be in the patient's rooms, and when you see that there's a change in a patient's condition, you're going to utilize the rapid response and follow these steps to call the nurse.
Okay. So whenever their heart range goes down or their blood pressure is low or too high, then we can call?
Yes, and these will be on the wall in the patient's rooms.
Okay. Very neat.
This presentation was intended for all hospital personnel, especially nursing services. Thank you for viewing this video, and if you have any questions, feel free to leave them in the discussion board and I will answer them as soon as I can.